This is Fox 13 Business Now.
Hi, welcome to Fox 13 Business Now. We're here today in Sandy, Utah at Turning Point Centers. I'm here with Chris, the admissions director, and this is one of your newer facilities, but you've been around for 4 years, is that right?
Correct.
So tell us a little bit about the process.
So Turning Point Centers, we've been open for 4 years. We are licensed as both a mental health facility and a drug and alcohol treatment facility. So we are what you call a dual diagnosis facility, which means we treat the co-occurring issues surrounding addiction. Oftentimes people who drink or abuse drugs are really trying to self-medicate or alleviate the underlying mental anguish that is driving the addiction. So
depression,
anxiety, unresolved grief, trauma, those kinds of things that they're unable to process on their own. So our goal is to help them heal completely. Now, a typical treatment episode for someone is to come into the residential program where they live with us for 30 days on site. And as you can see, we make it very comfortable to facilitate that healing process. Once they complete the 30-day portion of the program, they transition into an outpatient program where they continue to get support from the clinical team, but continue on with their regular life.
Okay.
So really a good blend of intensity and transition.
So they come in after they've left for the 30 days, they come in maybe once a week or?
Three times a
week, okay.
And then the family comes in once a week and they also meet with their therapist once a week individually.
Okay. And is it similar to other programs, or is this a little bit different?
What makes us unique is the fact that we use a very non-traditional approach. We focus on cognitive behavioral therapy as opposed to a 12-step approach. The 12 steps, incorporate the idea that a higher power is going to alleviate the addiction issue. But cognitive behavioral therapy, there's evidence that shows that particular approach helps the brain to heal. And so it revolves around a person being able to change their thought processes and their belief systems that drive the addiction to begin with.
Okay. And so it's hard for somebody to recognize it in themselves, probably. So lots of times it's a loved one or somebody that has to, recognize it and then help them to get the help. You've got how many bed facility here? You can accommodate quite a few.
We are a 16-bed facility. So we are what you would call a very small facility, and that creates a personal setting where clients feel safe to participate in treatment.
Okay. So you have an event coming up. Tell us how people can first get a hold of you and then a little bit about your open house that you're having.
They can go to our website, turningpointcenters.com, and all of our contact information is there. And then tomorrow from 11:30 a.m. to 2:30 p.m., we'll have an open house, and we'd like to invite the public to come and check us out.
Okay. So come on out tomorrow from 11:30 to 2:30. It is gorgeous. It is gorgeous. If there's a place you need to heal and overcome, and there's a lot of people out there suffering. You know somebody, if you're viewing this, that is suffering. So come out to the open house, check it out. Turning Point Centers in Sandy, Utah.